Hello, my name is Aura, and I'll be performing the postpartum focused assessment. First, I'll be entering the patient's room, knocking, and introducing myself to the patient, and telling the patient why I'm here using age appropriate language. I perform hand hygiene. I check the patient's safety, making sure the patient is safe. I give the patient privacy, and then I introduce myself. I check the handband of the patient, making sure that I'm with the right patient, using two identifiers, the name and the date of birth. And then I go ahead and ask the patient how the birth history of the patient. Is it through vaginal birth or through cesarean section? And then I move on to do the vital signs, getting the blood pressure, the respiratory rate, the temperature, and the respirations. I would also start by using the bubble E word. The B stands for the breast. So I'll be lifting the patient's top and inspecting the breast. I would ask the patient if the patient is breastfeeding or using the bottle. And I'm checking for cracks, I'm checking for mystitis or engorgements, and if any of those are present, it's our duty as a nurse to be able to educate the patients. And also, moving on to the U, I'll be assessing the uterus. If the uterus is tilting towards one side and is buggy, it means the patient's bladder is full. So we'll encourage and educate the patients to void. And so, assessing the uterus, I'll be using my non-dominant hand to hold the pubic region so the uterus doesn't fall out, and then I use my dominant hand to massage it downwards. I will press towards the uterus and make sure I feel a firm uterus. If the uterus isn't firm, it's a sign of hemorrhage or bleeding. I will move on to the bladder. I ask the patient for if the patient is able to void without any retention. I'll ask the patient if she has had bowel movements, and also moving on to the L, the lochia. I will be assessing and asking questions about the 3 stages of lochia, and then the E, episiotomy. I'll be assessing that, using the reader word, redness, edema, episiotomy, discharge, and approximation. I'll use that to check. And also I'll be checking the hormone sign, making sure that the patient doesn't have any form of blood clot. This is usually done through inspection and through the lower extremities. And then the mental status of the patient, I'll make sure that this patient does not have any postpartum depression, asking questions if the patient is safe at home and able to handle stuff. So that is it.